One type of strengthening exercise uses elastic bands. These are color-coded, depending on the amount of force it takes to stretch them. Only do your exercises on the schedule provided by your surgeon or physical therapist. It can delay your recovery to do strengthening, stretching, or active assisted exercises too soon. Do not do these exercises until your surgeon or physical therapist has shown you how to do them. Follow his or her instructions. Do your exercises slowly and gently. Loop the middle of the band around a doorknob and close the door. When grasping the band, your thumb should be on top. Turn so your healing arm is facing the door. Start with your elbow bent as if shaking hands. Then pull the band toward your stomach. Keep your elbow in the same place. Turn so your healing arm is facing away from the door. Start with your elbow bent and your arm across your stomach, your thumb on top. Pull the band to the side, keeping your elbow at your side. Turn to face the door. Pull back, stretching the band. For the next two exercises, put your foot on the band to hold it firmly in place. Pull up with your healing arm, stretching the band. Next, lift your arm to the side, keeping it straight, stretching the band. If your surgeon or physical therapist gives you permission, use a 1 or 2 pound weight to strengthen the deltoid, a thick muscle covering the shoulder joint. Hold the weight in your hand with your thumb up. Raise your arm diagonally away from your body and lower it. Faithfully doing your strengthening exercises is an important step in recovering from surgery.